Do you sleep okay that night?
I did. I mean, it was only 4 hours-ish because by the time the doctors came around for morning rounds, it was 6 a.m. So they came in and they did their best to walk me through it. And at that point, the only thing I cared about was being able to play basketball again, right? Basketball, athletics was my identity. I was like, I can handle anything you throw at me just as long as I can play, by September, right?
Okay.
Because I didn't grasp the severity of the situation.
Yeah.
I obviously I was like, okay, I don't really know what's happening here. Maybe this is the end, but there's probably treatment here. So,
Right.
3-4 months of some physical therapy and I'll be ready to go for the season.
It sounds like you were flipping between this is either super bad or like we can fix this.
Yeah, this is super bad, but you can fix this, right?
Yeah.
So,
Okay.
so they come in and they give an initial diagnosis of transverse myelitis. So transverse just means across, and myelitis is of inflammation. So essentially, we have it was a diagnosis of the spinal cord, a cross section of the spinal cord that had inflammation. So it was a really generic diagnosis that, looking back and after being in it for several years and meeting other people, most doctors just label it, any inflammation of the spinal cord, transverse myelitis, because they don't really know what's happening. They don't know a cause. They're like, we see some inflammation there. That inflammation is leading to scarring, or the scarring is already there. That scarring, when you scar nerves, it essentially, kills them. So we have inflammation around the spinal cord. We have scarring of the spinal cord. We don't know why. And I still asked, I was like, am I going to be able to, play basketball? And, at that point, the doctor was like, well, this is going to be a little, more intense than just a broken bone, right? This is going to be a longer process. We don't have any drugs or pharmaceuticals to just wipe this out completely. You can't just get a Pfizer drug for 5 weeks and then you can walk out of the hospital. Luckily, you don't need surgery, so we don't need to operate on you. There was no blunt force to my brain or my spinal cord. But all we have is we want to clear up that inflammation, so we'll do some anti-inflammatory steroids. Because at that point, they didn't know, when you first have these injuries, they don't know if the lack of function below that injury line is due to the injury itself or the second-hand response of inflammation to that area.
So the area the inflammation was that quite high up then?
Yeah. So it was C5, so cervical 5.
Yeah.
So that's the highest level of the spinal cord. You have the cervical, thoracic, lumbar, sacral. So that's right about the base of my neck, which lined up to where my function, was right around, right above my pecs is where the line between no function and complete function was.
Right, and that's why you couldn't originally get your arms up, and it's gradually gone down the body.
Right.
Okay.
Exactly.
Okay. Is that the final diagnosis, or was that the diagnosis at the time? Okay.
So, it's the final diagnosis for some physicians we've seen.
Okay.
So some will say, yeah, this looks like an autoimmune condition that caused scarring and inflammation. Others are like, this was a vascular event. Essentially, you had a spinal stroke. So most people think of strokes in the brain, right? You have an area of the brain that is no longer receiving blood flow and the tissue dies. What some of my neurologists think is that there was an area of the spinal cord that was not receiving blood flow, and then the nerves there died. So, but it's not just like you have this area of the spinal cord and just that cervical area that controls your shoulders or your arm is affected. Anything below that is also affected. So it was a really high injury on the spinal cord. And, I don't know what happened. I still don't know what happened, but I do lean more toward it being a spinal stroke, in my opinion, because I do have a blood disorder, which causes oxygen to not sufficiently be moved through the blood which
That's a blood disorder you had previous to that.
yeah,
Okay.
that it's genetic. So my dad has it, his dad has it. And that would make sense if oxygen's not flowing properly through the blood and you're doing all of this intense, work that could lead to areas of the body not receiving enough oxygen. And in this case, it was the spinal cord. That's just my hypothesis. I'm not a medical expert, but after just looking at it and trying to piece it together, that's kind of what I've come to think. And, I guess that's just what gives me the right word isn't comfort, but I guess satisfaction that's what I think happened.
And I'm guessing you've done a lot of Googling and research.
I did a whole neuroscience degree.
Because of this?
Because of
we
this.
will come to that. Okay.
Yeah, we'll get to that.
Right, okay. Yeah, isn't it strange though? Like, you would expect the doctors to just know. You kind of just expect them to know. And tell me if this is your experience. I'll do the experience of my mother when she got diagnosed with cancer. You get a diagnosis, but it doesn't matter how many people you see, there's not always a consistent recommendation of what you can do. So my mum basically did her own research in trying to treat it. She had the treatment from the doctors. She had different consultants give her different ideas what she can do, and then she did what she did herself. I don't know if you had a similar experience, but my expectation prior to this is, having not had anything serious myself, is that you just go, diagnoses are consistent, and the consultants give you a consistent plan of action. But that's not what was the case with my mother, which surprised me. I don't know if yours was a similar scenario.
Yeah, it was similar, where we would go to one doctor who was supposedly the renowned figure in the space. We would go to another one who was a renowned figure in the space. They would have competing diagnosis, and because they were competing, they had different treatment protocols. For the most part, one recommended this drug, another recommended this. One said this was important to do, the other said that's not important to do. So what I credit my parents for in this process is they were able to take multiple opinions, synthesize what they thought was the best course of action for me. And I tried to do my best in that scenario, but I was 15. So I was trying to understand everything and do my best, but really it was a large responsibility of my parents to try to make the right calls. And I think they made the right calls. Looking back, I don't think they passed up anything that I would have done or made me do anything that I wouldn't have done. So okay. I really give them credit, because there were a lot of competing ideas and a lot of competing, take this drug for this intense drug that we may or may not know the side effects of, go and do that. They had to decide, is the benefits of that drug worth the potential consequences of that drug?
How long were you in hospital for, that hospital?
That hospital was for 10 days because I had to do the anti-inflammatory course of drugs. And I also did this treatment called plasmapheresis, which is essentially a blood filtering process where they take your blood out of your body over a course of several days. They filter what they believe are harmful agents out of the blood, and then kind of push your blood back into your body. So it was like a filtering mechanism paired with those anti-inflammatory agents to bring down the inflammation around that lesion or that injury in the spinal cord. And those two combined lasted 10 days.
And during that period, what kind of functions were you getting back?
So during that time, not a lot of function. My days consisted mostly of just lying in the bed, and I was watching, there was a TV up in the corner, and I loved just watching the Nature Channel. Mm-hmm. I'm not sure why, but something about just deer running through the prairie. I was like, this is great. So I watched the Nature Channel a lot while they were doing those infusions, because those lasted. They would come in the morning at 9 or 10, and you wouldn't be done until the evening.
Holy shit.
You had to be there hooked up.
It's almost like dialysis.
Yeah.
Yeah.
Because that plasmapheresis I would relate to dialysis.
Right.
But so the two-pronged approach to these conditions, these neurological conditions where they have no cure and they have really no pharmaceuticals or drugs to give you to really do anything. It's not like they could just give me a drug to regrow that area of the spinal cord. That doesn't exist. So the two-pronged approach is, one, let's try to clean it up as much as possible. Get that inflammation down. Let's filter out harmful agents in the blood. Once we've done that, therapy. It's on you to do physical therapy with therapists and try to regain strength over time. And there's no guarantee that you'll get any strength back depending on the severity of the injury. But if you do the therapy and there is potential to get strength back and you do the therapy well, then you could regain, strength. So in my head, I'm like, okay, challenge accepted.
Let's go, motherfucker.
Let's go. I'm going to go to therapy. I'm going to treat it essentially like I was treating my basketball and my lifting. I'm going to, after those 10 days, I moved to a children's therapy center in Chicago where.
How far away is that from your home though?
2.5 hours.
Okay, so what was mom staying with you or traveling
Mom
up
stayed with me.
Mom stayed with you.
So she stayed up there so I was inpatient there for 6 weeks.
Okay.
So she stayed with me those 6 weeks. My brother and dad would come stay on the weekend. And then on the weekends, my dad would stay in the room with me. And then my mom would stay with my brother at the hotel. Because, one aspect that I don't think about enough is that my brother he's younger. So he's 2 years younger than me. He would have been 12 or 13 at that time. He was left without his mom. And my dad was working, to provide, right? So my dad was at work essentially the whole time. He was left essentially on an island by himself for months, right? And my grandparents pitched in as best as they could. His school principal would drive him home from school. So he was without parental, I wouldn't say without parental guidance, but not the same as the nuclear family being at home every night, cooking him dinner. He didn't have his mom for 2 or 3 months.
What kind of kid is he? Is he a good kid, naughty kid?
No, he's a good kid.
All right, okay.
But I mean, it's still, if you don't have you have your mom at that young of an age, he missed her. He missed me. He was worried about me. So that was really tough on him.
How was he around you at first? Did he know, was he cool with it or was he freaked out?
I think he was freaked out because, it's very shocking when, he still looked up to me, but he looked up to me from a strong, athletic, male standpoint, I guess, at that point. I don't know. Yeah. I don't know how you would have to ask.
You're the big brother, right?
I'm the big brother. And then he comes in and he sees, me in a hospital bed with no movement. So I'm sure it was an adjustment for him.
Yeah, the only thing I have to empathize with that scenario, when I was 18, my sister was knocked down by a police car. And the only reason she survived, the police car was at 50 miles an hour, is when she got tossed in the air, she landed on her mouth. Her teeth saved her. They were shattered, but they saved her. And she was my older sister, and I was taken to the hospital to see her. And she was actually in a coma and just strapped up to these machines. I think she died twice during the night. And it's so overwhelming. Everything's overwhelming. You have no idea what's going on. But I was 18. What did you say? He was 13?
Yeah.
Yeah, it's a lot to deal with.
So I'm sure he was shocked, but eventually he was cool with it.
Yeah.
But obviously any situation that severe is going to be shocking when you go in and you see someone, especially when hours earlier they were just fine, and then you go in and within a matter of hours it's a completely different setup.
But even though this is obviously a really testing time, did they start to get to a point where you could laugh and joke? Was that at all happening?
I think so. Yeah. We would make the best out of those situations. I remember there was a video of me still at the hospital before going to that rehab center, of me trying to pick up this cookie and eat it. Right? It's something so trivial to most people. You have a cookie on the table, put it in your mouth. Right? And it was this 3-minute process of me trying to grab this cookie off the table. And I had no arm strength. So I finally get it. And then my hands flop on my face. And I'm just eating it like that. Right. So there are those moments where it's not like this serious thing the whole time, right?
Yeah.
Like it's still your life. You're still trying to navigate it, and what are the next steps? And there's so many people coming in and out, so it's kind of like maybe exciting. You're like, oh, there's a new person there. They want to come talk to me now, and like, we're going to Chicago, you know. So it's like the emotions. It's emotional roller coaster of like, okay, this really weird thing happened to me, but like, oh, all these, you know, I'm going to Chicago for 6 weeks to this therapy center. This is interesting. And now all these people are tweeting at me because I don't know, they want to give their support or something.
Yeah.
So it's all of these really weird emotions bundled up, and you're getting your blood out of you, and put it back into you, right? So it's just it's very strange.
And so when you moved to the Chicago hospital, you said in those first 10 days you hadn't really gained any function back.
No.
So were you essentially quadriplegic?
Yep.
Yeah.
So I still am technically.
Technically.
So the diagnosis for a quadriplegic is just any paralysis in all 4 limbs.
Okay.
So where a paraplegic is paralysis in 2 limbs.
Yeah.
And most of the time that just means you have paralysis in your legs.
Yeah.
Because it's, like we said, it's hard to have paralysis, you know, in your arms and not in your legs, just because of the way that the communication flows from the brain. If you have like a spot up here, it's usually going to affect places below it. So because it's like that whole train track analogy. So anything below that spot is going to be affected for the most part. So I'm still a quadriplegic, you know, but people may or may not label me as that because I can walk around. And for the most part, people are like, okay, like he has a limp, he has, you know, weak hands, his hands don't look the same, they don't work the same, but he can walk around. So he's not a quadriplegic. But
yeah, you know. My assumption on if you're a quadriplegic, you're in a wheelchair. You have no function below.
Right.
Okay. So
there are
learn something today.
So there are, you know, it depends what your definition is, but the medical definition is that, like, if I go see my doctor, he's, you know, I'm a quadriplegic to him. So.
Yeah, and I'm pretty sure, like, I'm trying to remember back to the thread because, I mean, the last time I looked was shortly after I showed it to Danny. I read it twice. I feel like I saw you in like a chair, but like I feel like, were you strapped into it?
I don't think I was strapped in, but like I was like, it was a heavy duty chair, right? Like my arms were up here, and that was really one of the first chairs that I had. Yeah, that one up there.
Okay, so we'll put this up in the people on YouTube. Okay, and then what's the other one? Was that prior?
Oh, this one. This is from like a few months ago.
Right. Okay.
Yeah, that's my cat. This is me.
Okay.
So
that's not the original thread, though, right?
No, this is.
Is that the original thread?
Yeah.
Okay, yeah, I remember now.
So that was me trying to put my arms above my head, and I'm glad I documented that. I thought it was so funny. But
so was that before?
Yeah,
happened?
That was the night before. You know, my parents had to like carry me out to the car and go to the hospital. Right. It was that first day where I experienced symptoms, and you can see I can barely put my arms.
You look
above my head.
You look like a young college bro.
Oh yeah, I know.
Okay. So the 6 weeks. Where did you get from at the start to the end of the 6 weeks?
I gained a lot in those 6 weeks.
Okay.
So when I first got to the children's hospital, I was having a lot of neck pain from lying in bed for, you know, several days at that point. And when you lie in bed for that long, you lose all your muscle mass. It literally just melts away.
Yeah.
So everything, you know, I had work to build at that point, which wasn't a lot. I was like 14 or 15, but all of that muscle mass just pretty much melted away. And I could barely like lift my head up off the bed. So when I first got to that children's center, I remember them coming in the first day, and they're like, all right, we're going to put on socks. And I was like, I can barely lift my head off this bed without screaming in pain. So I remember that first session, I was like crying because it hurt so badly. And my mom was like, okay, like we need to get him medication to take away this pain so that he can actually participate in therapy. So they put me on an oral steroid, and that like immediately eliminated the pain, which was beautiful. And I've reflected on this a lot, and I've given the advice to people who have just gone through these types of events that you want to get to as little to no pain as possible, because then you can actually focus on recovery. It's really hard to focus on what what my next step should be or going to therapy when you're just in severe pain the entire time.
Yeah.
And obviously, some people do have to do both. There's no remedy for their pain immediately. And maybe they'll have pain their entire lives and they have to manage that pain while they do therapy. But if you have the ability to eliminate that pain or at least tone it down so that you can do your therapy, I think that's a good course, because as soon as that happened to me, then I was like, okay, sure, I'll try to put on these socks. I have no function in my hands. I cannot sit up. I have no core strength. I'll try to put on these socks with you for an hour straight, right? It took me an hour and I probably didn't even put it on. So those 6 weeks are, I really enjoyed it because of the intensity of it. You had 2 hours of physical therapy each day and then 2 hours of occupational therapy.
Did you like the intensity because it was almost like training, like
Yes.
back to basketball?
Yeah.
But had you also convinced yourself like you will, at this point, are you thinking you're going to get back to full function?
I'm like, I'm going to walk out of here in 6 weeks.
But do you believe you would be getting back to the point like the video? You'd be getting back to...
Eventually, I was like, okay, maybe I got to miss the season.
All right, cool.
Right.
Okay.
But like junior year, I'll miss this season, but junior year, I'll be able to do it. I'll be able to play at that level that I want to play at.
Caroline, is he competitive with everything?
Yes.
Yeah, I thought so.
Yeah.
Okay, I like that.
So the therapy, so the physical therapy is what you would think of. It's like, let's try to stand. Let's try to do some core exercises. Let's try to sit on this ball without falling off. And then the occupational therapy is really for hands. Most people think of occupational therapy as I got hurt on the construction job and now I'm going to work on that specific aspect so that I can go back to my job. Because I think in America, like occupational therapy is like synonymous to like you're doing therapy so you can get back to your job. Like if you have like a labor job. But in this case, in like my treatment plan, it was focused extensively on my like anything below my shoulder. So my hands specifically, like, can you brush your teeth? Can you use the bathroom? Can you put your clothes on? Can you make your bed? All of these little tasks that, everyone just does. It's not, most people say, I had to relearn how to do that. It's not relearning in the sense that I forgot how to brush my teeth. It was, okay, I have a toothpaste right in front of me. I have a toothbrush right in front of me. How am I going to unscrew the toothpaste when I have no grip in either hands? And all I can do is maybe pick up the toothpaste like this. How am I going to brush my hand or brush my teeth when I cannot like pick up a toothpaste, unscrew it, squeeze it onto my toothbrush, pick the toothbrush up, and then brush my teeth? How am I going to do that when all I can do is put my hands in my face?